Assalamu alaikum dear viewers, I am Professor Khalil ACP. Previously, we started an essay, Healthcare System in Pakistan. Today, we will talk about its tiers. Basically, Pakistan is following the system of England. Beverage system of healthcare that is applicable in England, and Pakistan has taken it metaphorically from the English society or from England. This system has three tiers. The first tier is the primary tier, and the second one is the secondary, and the third one is the tertiary. What is the primary tier? Means that the health system starts from the commoners, and that commoners, they just deal with the doctors. At first, in what way a layman tries to get some help from the doctors, and that treatment starts from there. It means that commonly the people from the society, they just move toward the doctors for the common disease and just get a clarity to what extent they are ill and in what way that ailment can be seized right there from the beginning. This is just a source of education, and that education is being imparted from the healthcare professional advisors. And normally the people visit there, but that is just for the specific community, not for the local people or the common people. Just like the poor people, they don't have such sort of facilities just to entertain themselves in the beginning and visit the hospital on routine basis. That system is applicable only on those people who can visit the doctor just for their primary treatment. Normally there are so many hospitals here in Patogi or as well as in Pakistan, and the people don't get bothered about it, that either they have any sort of disease and they normally go to the medical store and get treated by the doctors. This is just the first minor issues are being treated by the doctors. We normally visit to the hospital, and the people visit to the hospital and they just get the primary care of their own self. It is just the visit of a family doctor, and mostly the rich people do, not the normal people can do that. Now the people who belong or who pass through the tertiary, it means intensive care, when they just get escaped from that ailment, they normally visit on routine basis to the doctors, and they also fall in the same primary healthcare system. And after that, there is the secondary healthcare system. Those people who just get in some intensive ailment, normally they just visit to the professionals. It means the people, they are being referred by the PT professional advisors to the specialist, and different specialists, they are working in different cities. Normally we visit from here to Lahore or the bigger cities where we find out the specialist, just like oncologist who treats cancer patient of any sort, cardiologist who treats the heart issues, and gynecologist, the issues of mother and child, they are being handled properly by a gynecologist. And dermatologist, if the people have some skin diseases, those diseases can be easily checked by the specialist of it, and certain medicines are being given to those patients. And if you have an eye disease, then ophthalmologist, they just treat the eye diseases. It means after the primary healthcare system, a person moves to secondary healthcare system. It is just a transformation of professional advisors to the specialist, and they just treat them on a specialist basis. And in this secondary system, the issues of allergy, they are also be resolved. For example, there are certain infectious diseases and they are not in control of the professional advisors. They are also be referred to some specialists. And contagious diseases, if they spread in that specific area, and in what way that can be seized, and there is a requirement of some specialist who can just treat those patients in a most proper sense. Surgery. Normally it happens when the disease is so severe and a life-threatening disease or such sort of situation prevails somewhere else. Then they enter into the third portion. It is intensive care system. Advanced equipments are available and treatment and procedures are available through which that disease can be controlled. And especially it can be said that when a person is bound to be hospitalized and they just visit to the hospital and they are normally admitted in the hospital and they are being treated by the metropolitan medical care, so medical center.